Welcome to the MicroMolar Podcast Biotech Signal Series. Today is Monday, May 18th, 2026.
Let's get straight into today's top signals.
Merck's ADC SAC-TMT achieved its first global Phase 3 win ahead of schedule. The result strengthens Merck's position in the increasingly crowded ADC race and could accelerate future approvals and combination studies.
The Supreme Court declined to hear pharma challenges to the Inflation Reduction Act. That leaves Medicare drug price negotiations fully on track and increases long-term pricing pressure on major drug makers.
FDA leadership turmoil intensified as Marty Makary resigned and CDER chief Huig was removed. The shakeup could materially influence future FDA policy tone, evidence standards, and review priorities.
AstraZeneca's aldosterone synthase inhibitor baxdrostat won FDA approval for difficult-to-control hypertension. The drug introduces a differentiated mechanism, though competition in the category is already building.
Regeneron's Phase 3 skin cancer failure adds to mounting disappointments in LAG-3 immunotherapy. The result raises broader doubts about whether LAG-3 can consistently expand beyond Bristol-Myers Opdualag.
Merck KGaA says Iran war disruptions are driving stockpiling behavior among customers. The update highlights how geopolitical instability is now directly affecting pharma supply chains and purchasing patterns.
Pfizer delayed the patent cliff for blockbuster heart drug Vyndamax. The move protects a major revenue stream and shows how lifecycle management remains critical for large pharma.
Cytokinetics says its Camzyos rival is seeing a strong early launch. The uptake suggests physicians are open to alternatives in hypertrophic cardiomyopathy treatment.
CSL shares hit a 9-year low after a revenue warning and a roughly $5 billion write-down. The sell-off shows how sharply investors react when traditionally stable biopharma companies reset expectations.
Lonza is expanding workforce and factory capacity to capture growing ADC demand. CDMOs continue betting heavily that ADC manufacturing will remain one of oncology's biggest infrastructure needs.
Novartis is facing questions about whether generics can eventually compete with its radioligand cancer franchise. The discussion highlights how specialized manufacturing could slow competitive erosion.
Design Therapeutics shared updated Friedreich ataxia data, while Vincentage released obesity results from China. Together, the updates reflect continued momentum in both rare neurology and metabolic disease.
Those are the top 25 signals for today. Thanks for tuning into the MicroMolar Podcast.
Visit micromolar.com for more information. See you next time.